My name is Catherine Price. I'm a physical therapist. Please consult your medical doctor or physical therapist for the appropriateness of exercises for you. Today I'm going to go over a rehab program for a total knee replacement. These are the exercises that I commonly prescribe for the first 2 weeks following a total knee replacement to be done twice a day. And it can be helpful to get started on these before your total knee replacement if you know that you're going to have a replacement, just so you can know the routine and form the habit. So I am going to first start with a word of life from James 4:7-8, and that says, "Submit yourselves then to God, resist the devil, and he will flee from you. Come near to God, and he will come near to you. Wash your hands, you sinners, and purify your hearts, you double-minded." Amen. So I am going to go over exercises for total knee replacement rehab. And the first one, I'm going to start with our quad sets. Now, these exercises are to be done in this particular order for them to be the most beneficial. So the first one is going to be, and I am going to suspect that, and I just put a brace over the right knee. So we are going to do these exercises as if I had a total knee replacement, or I'm going to have one on my right side. So the first thing I'm going to do is I can lie on my back, or I can do these sitting up. But what I'm going to do is tighten the thigh and press the back of the knee down into my bed or into the table. And you can see the heel lifts up. And I want to hold that for a count of 5. So if I'm lying down, it's going to look like this. I'm going to tighten my thigh and hold for 5 counts. 1, 2, 3, 4, 5. Relax. And tighten and hold. 2, 3, 4, 5. Relax. 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 And tighten and hold. 2, 3, 4, 5. Relax. I'm halfway there. I'm going to do this 20 times. I'm going to do the second set sitting up, so I'm just going to press and hold. 2, 3, 4, 5. Relax. Tighten that thigh. Lift. 1, 2, 3, 4, 5. Relax. Tighten and hold. 2, 3, 4, 5. Relax. Tighten and hold. 2, 3, 4, 5. Relax. Tighten and hold. 2, 3, 4, 5. Relax. 5 more. Tighten and hold. 2, 3, 4, 5. Relax. Tighten. 2, 3, 4, 5. Relax. Tighten. 2, 3, 4, 5. Relax. 2 more. Tighten. 2, 3, 4, 5. Relax. And last one. Tighten. 2, 3, 4, 5. Relax. So with a total knee replacement, the extension is going to be important to get back first. So those are the quad sets. That's exercise number 1. Number 2, I'm going to roll up some towels, or I can use a foam roller, and I'm going to place it underneath my knee. So you can use even a coffee canister or rolled up towels. If you have a foam roller, great, or even a nice pillow that's folded that gives you a little bit of support under the knee. So you just want to place that right underneath the knee. I will do this lying on my back. I've got my knee rested. I'm then going to try to tighten my thigh and straighten my leg as much as I can. If I have difficulty getting that leg fully straight, I can use some assistance, but I'm just going to straighten as much as I can and then bringing it back down. That's 3. I want to do this 30 times. 3 sets of 10 are good to start with. 4, back down. 5, down. 6, down. 7, down. 8, down. 9, down, and 10. These are called short arc quads. So we're just doing a small range. And if I do have difficulty getting that full extension, so when I'm with my patient, I will help them to fully extend the leg. But if you're just getting to here and you need that little bit of help, you can use then a leash, or you can even use a sheet, but something just to help lift that leg up. But you want to try to do it by yourself. 3, down. 4, down. 5, down. 6, down. 7, 8, 9, 10, and relax. Take a deep breath all the way out. And then one more set, just straightening that leg and then bringing it right back down. 3, 4, 5, 6, 7, 8, 9, 10. So after I do shorter quads, and then it's going to be difficult to lift that leg, but you'll take the roller or the towel roll out from underneath, and then you want to sit on your edge of your bed, or this can be done if you have a potty chair or a high chair. You want to be sitting where you have enough room where the legs are hanging. We're going to do, these are called well leg exercises. So the first exercise is a quad set, the second is a short arc quad, the third is a well leg exercise. And what you do is, my well leg is my left leg, so I'm going to take the good leg or the well leg, you're going to put it behind the surgical leg, and then help it extend all the way out. Hold for 5 counts, 2, 3, 4, 5, and then I'm going to bend the surgical leg back and then press with the well leg and give it that bend till I get a stretch on the front of that surgical knee. And then I'm going to extend back out with my muscles and then use the other leg to push it. 1, 2, 3, 4, 5. Bend my leg, then push with my well leg and hold. 2, 3, 4, 5. Extend and then push with the well leg. 2, 3, 4, 5. Bending it back. Hold. 2, 3, 4, 5. Extend and then press. 2, 3, 4, 5. Bend and then press. 2, 3, 4, 5. Extend and then press. 2, 3, 4, 5. And bend and press back. Hold. 2, 3, 4, 5. Straighten that leg and then press. 2, 3, 4, 5. Bending it back and press. 2, 3, 4, 5. Extend. 2, 3, 4, 5. And bend. 2, 3, 4, 5. 3 more. Extend. 2, 3, 4, 5. Bend with your muscles. Press with the good leg. 2, 3, 4, 5. Extend the surgical leg. Press with the good leg. 4, 5. Bend and then press back. 2, 3, 4, 5. Last one. You're just straightening as much as you can using your muscles, pressing with the non-involved leg, and then bending that surgical leg and crossing over and pressing using the well leg. 2, 3, 4, get that knee flex, the mobility, the extension, the flexion, and sometimes to move back and forth, you want to hook that well leg underneath the surgical leg, come back up onto your bed or onto a surface that's comfortable where you can lie back. Then I'm going to take my leash, hook it over my toe, and you want to do these again in this order. So I'm going to do heel slides next. I'm going to lie back and I'm going to use my leash or my sheet, and I'm going to help bend my knee up as far as I can and then straighten it back out. And I'm going to do 3 sets of 10 heel slides. 2, 3, 4, 5, 6, 7, 8, 9, last one, and 10. And then relax. Now you'll do these a lot slower than this because it's going to take some time to bend. Now it is going to be painful to bend. This is productive pain. And you can try to do this with the breath to help with that. So you can breathe in. And as you bend it, you can breathe out, trying to get your body to relax. Breathing in and breathing out. 2, 3, 4, 5, 6, 7, 8, 9, 10, and then take a pause, deep breath, and then back to your last set of heel slides, and you're just pulling that knee up as far as you can get it to go, and then straightening back out. As you continue to do these, you just want to try to work it up further and further. Usually you're going to get quite a bit of range within the first 2 weeks, and it'll happen quickly, but you want to stay consistent and persistent with the exercises. 4, 5, this helps stay ahead of the scar tissue. 6, 7, 8, 9, and 10. So after I do the heel slides, I'm then going to do a straight leg raise. And I can bend my opposite leg, and I'm going to tighten my thigh and lift it off the table and bring it right back down. Now I'm not helping, but if I cannot keep that knee straight, then I can keep the strap on the foot to keep the knee straight. And then I'm going to use my thigh to just help my leg lift as much as I can. 5, 6, 7, 8, 9, one more, 10, and pause. Now when there's a lot of swelling in the knee, it shuts the quadricep muscle down, and it makes it very difficult to lift the leg. So some folks are going to have a hard time lifting the leg within that first 2 weeks, depending. And some will not have any trouble at all, and it just varies from person to person. This now our second set, so I'm just going to lift and then bring it back down. 2, 3, 4, and again, I'm doing this with my muscles. I only use the strap if I'm unable to keep the knee straight. 5, 6, 7, 8, 9, one more, and 10. And so on this last one, I am going to take the strap off just so you can see and make sure that you do them without the strap if you can do these on your own. So you're tightening your thigh, keep that knee straight, just like with the quad set, and then lifting and bringing it right back down. 2, 3, 4, 5, 6, keep a nice tight core, 7, 8, 9, last one, and 10. So that is exercise number 5, the straight leg raise. So for the last thing, and this one I actually recommend doing 3 times a day, but all the other ones twice a day, and this is going to be a heel prop. So I'm just going to take the foam roller and I'm going to prop that heel there, and there's nothing on the back of the knee, and I can even use an ice pack to put over the knee, and I'm just going to lie here with that leg straight for 5 minutes. And I don't want to stay any longer than 5 minutes. 5 minutes is plenty. And when you first start out doing this, you may only tolerate about 2 or 3 minutes, and that's okay. You should start to feel a stretch on the back of the knee, and it can get quite uncomfortable when you first begin this, because again, you want to get full extension of the knee. That is going to be what you want to get first after a total knee replacement, and then you want to work on the knee bend, and it will progressively bend more and more if you just stay consistent with the exercises. So I would lie here for 5 minutes. You can set a timer, and that is it. So those are the 6 exercises I prescribe after a total knee replacement for the first 2 weeks, to be done twice a day, heel prop 3 times a day, and these I call my bread and butter exercises. And if you do your bread and butters and progress as your physical therapist tells you to, you should be on your way. Again, you want to make sure that these are appropriate exercises for you. And I hope this is of help. Have a blessed day. Thank you.